Good afternoon, everyone. I'd like to welcome you today to UCSF Family and Community Medicine Grand Rounds. Today's session is an exciting topic. It's working collaboratively for chronic disease equity, how UCSF partnered with the community for lasting impact on local health equity, lessons, challenges, and opportunities. We have a wonderful panel today. I'm going to let them introduce themselves, but first, just a few reminders. For starters, this session is being recorded. And if you've missed part of today's session or you'd like to see other sessions, please join us on the UCSF Family Medicine Grand Rounds website. You can find us on YouTube or just the department website to see this or any other session recorded. If you have suggestions, either for our presenters today or topics for other presentations you'd like to hear, please go ahead and fill out our suggestion and evaluation sheet, which we will send around in the chat as we get into the session. I want to thank our tech team. I always want to thank our tech team, but especially so today to Benjamin Wallen, Erigo Mitchell, and Roy Johnston for their help and support in making sure that things run smoothly. Today's session is really a session that is designed to be highly engaging and interactive. So please use the Q&A section to type in questions and comments for our panelists so they can make this a lively discussion. And then just as a reminder, you'll notice that today's session is called Part 1, Building to Policy and Structural Change. It's called Part 1 because there's a Part 2. This was too big a topic for a single session. So we're going to have the opportunity to get started today and then hear more on January 10th. Today's session is really a look at how UCSF's community engagement resources were deployed for more than a decade to create a lasting impact towards chronic disease equity. Through collective impact, our panelists today and others have helped shape health policy and build the environment. They've also helped improve access to healthy foods in low-income communities and helped create the largest source of funds for community-based organizations to engage in work that helped increase consumption of fruit and vegetables, reduce consumption of sugary drinks, and increase consumption of public drinking water, amongst other important things. Our panelists today are going to discuss what they've learned about collective impact and partnership along the way, and importantly, what opportunities lie ahead for community university partnerships for health at UCSF and beyond in the community. So I'm going to warmly welcome our panelists and allow them to introduce themselves today. Thank you so much for joining us.
Thank you so much, Dr. Venner. Good afternoon, community, family, community medicine, and beyond. Really excited to share this work with you all today. And just a warning that I will be sharing some background for work that, as Dr. Venner described, happened over more than a decade. So it'll be blindingly fast for so much work, so much effort, and so much time. But I do want to make as much time as possible for you all to hear from our guests. And as Dr. Venner mentioned, we will have a Part 2 early in 2025, January 10th. So without further ado, I will begin sharing this story with you all. And then you'll get to hear introductions from each of our guests as they join us in conversation. So this is about collective impact, and in particular, collective impact to address chronic disease inequities in San Francisco. We focused on education in these different realms. We also leveraged our research resources, and we engaged collectively in advocacy. And you'll hear about how university partners can engage in advocacy, and importantly, how important our community partners are in leading advocacy efforts. And I'd love for my colleague, Christina Goette, who is Deputy Director at San Francisco Department of Public Health, to please join in conversation for this overview of this timeline, speaking specifically to the sugary drinks work um, that was primary in addressing chronic disease equity. Please join us, Christina.
Good afternoon. It's a pleasure to be here. There's really been a long history leading to the passage of the soda tax, as has been mentioned. And this timeline, I don't really expect you to be able to read it. I'm going to blaze through this pretty quickly. But we use a whole spectrum of prevention in the work that we do. And it really began with education. And if you can click first, we did education around, and I say we, it's the public health department through the Shape Up San Francisco Coalition, which is a public-private partnership. We worked with our UCSF colleagues and community colleagues in developing a whole range of educational materials. And it started in 2008 and continues still to this day. We also, the health department did some critical early data analysis. You can click the data or do the next click where we did some analysis of CHIS data. It gave us a sense of where sugary drinks related diseases were happening, who was drinking sugary drinks. We developed maps. And you can see that today also on the Soda Tax website, more maps. Where is the funding going? But that's really more for part two. We also did a lot of work around community engagement, right? Through the Shape Up San Francisco Coalition. We partnered with UCSF, Roberto, and others on the HEAL Zone. It was a Kaiser-funded initiative focused specifically in Bayview. We brought on local residents to be food guardians. They did a lot of work, both around healthy retail, but also around, helping make the case for sugary drinks and limiting sugary drink consumption. So they're absolutely critical in this work. And as you can see, as we, these different types of work areas all contribute and are always done in partnership with others. It's never just the Department of Public Health or just the community or UCSF. We're always doing this work together. And that's what leads us to organizational change, which is the next click. We started with healthy vending, Rec and Park, and the Boys and Girls Clubs, the YMCA, and Baby Hunters Point Foundation all adopted organizational policies to limit the amount of sugary drinks, to be serving healthy food, to be sure to be serving water at all of their different events. So we're building up to bigger policy by doing smaller policies at the organizational level. And that then took us across to policy changes. And again, you can see that these little circles or squares are popping up across this, this timeline. None of this is really linear. It happens in different waves and cycles. But the policy changes include the first effort to pass a soda tax in 2014, which didn't quite make it, but it did pass in 2016. In between 2014 and 16, our supervisors placed a ban on using general fund dollars for the purchase of sugary drinks, as well as some other policies that did not go the distance. But then we're also now in the phase of policy implementation, and that's the last click. And that is something that we'll be talking more about on January 10th. But that policy implementation is with the Sugary Drinks Distributor Tax Advisory Committee. DPH backbones that. We help do the evaluation for that. But we've got important community members that sit on that committee, as well as partners at UCSF that were there from the beginning. Roberto, one of the first co-chairs, and Abby, current co-chair. So what I'm trying to say is here is there's a long history. There are so many different elements to this work, from education to policy to community engagement. And all of this work has been done together with the community, with UCSF. And we are extremely fortunate to have such an incredible resource here in San Francisco. So I'll pass it back to you.
Thank you so much, Christina. I appreciate what you're saying, that this has required collaboration throughout, and it hasn't been a linear process, and that we have impacted multiple layers across the spectrum of prevention from the individual level. We engaged in individual level education all the way up to policy and structural change, which we'll talk about. Began with, as Christina mentioned, the work of Shape Up San Francisco Coalition, really pulling together folks to address healthy eating, active living. San Francisco Health Improvement Partnership was a coming together initially of the San Francisco Department of Public Health and UCSF to try to figure out how can we better leverage our collective resources together to address chronic disease inequity in San Francisco, looking at multiple issues, including chronic disease in particular, but also alcohol retail and others. Shout out to Paula Fleischer for leading the work on alcohol policy, along with Dr. Laura Schmidt, who we'll hear from later, who is also pivotal in this work, in particular around policy. And SF HIP included community folks. So Kent Wu, who you'll hear from Nico's Chinese Health Coalition, Central American Resource Center, Rafiki Coalition, and others, along with our partners across multiple health systems and the hospitals across San Francisco. So together in coalition, we identified chronic disease inequity as an issue that we needed to work on together. And so we say that we adopted this collective impact approach, but honestly, we began this work in 2009, and this model was coined in 2011. So when we saw this, we said that sounds a lot like what we're doing, and this is a helpful framework for us to adhere to. So identifying a common agenda, having a backbone organization like UCSF and SFDPH, and with all these other elements. And these are a list of the different stakeholders. So as you can see, folks from across different public systems, community organizational leaders, et cetera. And as Christina mentioned, some of the ways our public health partners held their stake was to provide education, capacity building for peer education, including training up promotoras and lay health workers in community, and then really providing the bulk of the data we had access to understand baseline, what we were dealing with, and to track progress over time. And to visualize that data was really a helpful tool for us to communicate to different communities in San Francisco why this should be important to them, and also a helpful tool for communicating to policymakers why it should be helpful to them. And these are examples of some of the public health campaigns that Christina spoke about. This is some of the visualization of data. So being able to map disparities, this particular disparity, diabetes hospitalization as a result of unmanaged diabetes, but we also mapped stroke, heart disease, obesity, and overweight. And as you can see, the maps align with sugary drinks purchases, which is a map there on the right that we created. And later, we would find actually these map very clearly with redlining maps. So, decades later, these health disparities showing up as a result of policy that was set decades prior. Community partners, and you'll hear from them more about this later, helped convene focus groups so that we could hear from community about, for example, what kinds of policies they were willing to support. And then we found alignment with those policies scientists said had an evidence base around effectiveness. They adopted beverage policies in their organizations, and they did education and counter marketing that was super important for shifting perspectives in community. Here's one example of a counter marketing campaign in the Bayview with the Bayview Heal Zone, and this young man was featured prominently because of his work offering his free services to help people wanting to engage more in physical activity. He was a trainer. And as Christina mentioned, we had leaders from community, and this leader here is Antonia Williams, who's a food justice worker, a food guardian is what we were calling them in those days. Um, and she helped lead efforts to do healthy retail transformation. So that work was to provide produce in small corner stores that many residents in the Bayview rely on for accessing food. It was a public-private partnership, and they would also do education in community for how to prepare new foods with fresh produce. And here, Antonia is providing education to family community medicine residents about that work for them to understand what communities were doing to address chronic disease equity. The community-based education we decided needed to be deployed in the Asian Pacific Islander community. NICOS helped lead that. Rafiki Coalition helped lead this work in African American community, and Central American Resource Center helped lead it in Chicana Latine community. Very, very powerful to have these folks leading that work. They are trusted communicators in community. They understand the best way to craft messaging. And here are some examples of how we not only translated materials, but transcreated in partnership, in this case, with Chinese community to develop imagery that would be particularly engaging there. And here are some elders in that community providing education about sugary drinks. And they also made sure that spa water was available at events to help disseminate the message broadly. Now, as UCSF, some of the ways that we engaged in this work include leveraging science-informed strategy and policies. Laura Schmidt, who will speak with us briefly, was the first that I heard speaking in San Francisco about this need for leveraging that particular policy change. And later, she helped advise multiple policymakers in the crafting of what would ultimately become soda tax policy in San Francisco. We deployed UCSF learners, including family medicine residents, to help with community-based participatory research in partnership with those same community partners I described to gather community perspectives on this work. We deployed folks with expertise in water consumption to understand what was going on in the public around water consumption. We had student helpers doing education in community-based settings, among other things. We had family medicine and other School of Medicine students gathering information from community about where they wanted to see water stations located. You'll hear more about that in part 2. And then developing authoritative education materials like sugarscience.org, which was free from industry-influenced research. Some of the educational materials that were web-based were really important, particularly at a time when the industry was trying to fund disinformation campaigns online. Some of what we learned from community through that research was about what they were willing to support, including protections of children. They wanted things to be kept affordable and were willing to see a tax if it were on producers or distributors, but they did not want to see a tax on consumers or retailers. And ultimately, the tax that passed is on distributors. And they wanted better access to water and an understanding for why they should trust that it was safe. Policymakers convened hearings, proposed policies, including the healthy retail policy, which provides supports for other communities interested in improving access to healthy foods the way we piloted through the Bayview Heal Zone through these collaborations, and sugary drinks policies that Christina described. As Christina mentioned, 2014 tax failed, and as you can see, there are differences in which communities supported, but it still got majority of the vote. And as a result of that majority, Mayor Edley came back and asked Board of Supervisors to propose other policies. the industry paid people to follow us around. Here's an example of folks following us around with GoPros to develop messaging to counter the work we were doing. They staged rallies at San Francisco State University and elsewhere where they hired students. You could get, there was an ad on Craigslist, $15 an hour, come join this rally. And this guy on the bullhorn looks very passionate about no on a soda tax, is seen here collecting his award. He's employed by a local firm to do messaging for industry, and they got an award for their work fighting the first 2014 tax. And because we failed to get a 2/3 vote that would create a dedicated tax, but we did get a majority of the vote, it demonstrated popular support. And so that's why we were able to pass these other policies. The one that's still standing is no purchase of sugary drinks with city dollars. And Dr. Schmidt, myself, and others helped provide advising, with Dr. Schmidt leading the way to help hospitals adopt sugary drinks policy across the city. So we'll hear more about the soda tax later, but just so you know, it helped collect money into the general fund and set up an advisory board to propose investment strategy. Well, we heard more about implementation in part 2. It's approximately $15 million a year. Some lessons: investments in collective impact can yield structural and policy change. Important to have backbone and navigator staff to sustain partnerships. You'll hear some detail about that. Science can provide evidence for policy, but only communities can lead advocacy for change. Learners can advocate and educate in community. Community leaders do want some expertise that UCSF can share, particularly around policy practice and evaluation. And UCSF has supportive services for community engagement. So, sorry for taking up so much time, but I want you all to hear from our panelists. So let's hear now, and we'll continue. We'll continue the conversation collectively, please. So, please join us on camera, those of you who are panelists. And I'd love for you all to share, to begin the conversation. What was it that enabled you to partner with policymakers, with community, with researchers? And let's begin with you, please, Dr. Schmidt, from the perspective of a researcher.
Sure. Thanks, Roberto. So I'm a sociologist and public health researcher at UCSF in the School of Medicine. And I spent the first 20 years of my career studying alcohol policy and thinking about regulatory and environmental strategies to address the oversaturation of low-income communities with alcohol outlets. And in 2009, the community engagement program within the UCSF CTSI, along with the health department and many, many stakeholders, and that eventually grew into the San Francisco Health Improvement Partnership Collective. We held a big convening of various stakeholders within the city to learn more about what people needed and wanted in terms of health equity. And it was in that context that I got seated at a lunch table with one of the San Francisco supervisors, Eric Marr, who had just rotated off of the school board and was very interested in childhood diabetes and disparities in health. And I started talking about all the alcohol research I did. And he said, well, what can we do? What can we do to address health inequities? And I said, well, in the diabetes prevention space, we don't really have much. We've got taxes and warning labels and all this great stuff, indoor air laws, to regulate tobacco harms, but we've got nothing when it comes to our food system and ultra processed foods and so forth. And he said, "Oh, that's interesting. Well, why don't you come to my office and let's talk about it?" And so that got me thinking, poking around in the literature. And it turned out that there was a paper published around that time by scientist Kelly Brownell at Yale, saying in the New England Journal, saying we should be taxing soda just the way we tax alcohol. And I thought, oh yeah, and there was emerging evidence that in the literature through simulation modeling that the taxes that work for alcohol and tobacco would work equally well. And there was even literature on a paper in the BMJ about like, what are the effect sizes you need? How much of a tax do you need to get a meaningful impact on health? And so I pulled some of that together and put it on a laptop and sort of menu of options and sat down with Eric, and that turned into a very extended relationship all the way up into the time that we wound up passing the tax with all of these wonderful partners in the city, with the health department taking the lead, and Scott Wiener, who is now in our state government doing amazing things for health, happening at the local level. And what we achieved from all of that was not just the tax, and we have 5 of them now in the Bay Area, but other policies, as Roberto mentioned. And I want to say that I looking back on this, and since then I've worked with various nation states actually around the world. We now have Mexico was the first to pass a national level tax in 2014. And we now have about 50 nation states around the world doing what San Francisco did in 2016, putting a penny per ounce tax on soda. And I've worked with the Pan American Health Organization and the World Bank to educate policymakers about this strategy. But the key, I think, and the reason the industry fought San Francisco so long and so hard on this, as well as other Bay Area cities, was because when you produce a local policy change, that means scientists can come in and study the impact. And the impact has been studied, and there is now an enormous literature. And this is why you can go to the World Bank and tell Kazakhstan, literally work with Kazakhstan on a tax, because we have research showing that it moves the dial on health. It doesn't cause economic disruptions and all of the kinds of problems that the industry warned, the sky will fall if you pass a penny per ounce tax on soda. And all of this research is possible to document. There's a wonderful study by Justin White and colleagues that just came out showing that gestational diabetes in low-income women declines in cities that tax soda. So initially, we didn't even have one study showing that it could affect sales of soda. Now we have a whole literature showing you can move the dial on health markers in vulnerable populations. And I think this is the legacy of a local city and a coalition of community-based organizations and a health department and a university coming together and trying to move the dial on health equity. It opens up new possibilities for other actors around the world to create innovation in health. And so I think it's very important and to understand the virtuous cycle that we build when we try a new innovation, we study it, we document its impacts, and then we disseminate that knowledge.
Thank you so much, Dr. Schmidt. And I want to say that other UCSF scientists like Kirsten Bibbins-Domingo, Dean Schillinger, also had pivotal studies early and later, including the modeling of what an impact of a tax could mean around chronic disease inequity, understanding the impact of the tax. And Dr. Schillinger was one of our early and few advocates on behalf of the scientific community. And so what we saw was, I mean, we had the lawyers of UCSF sit down with us and say, we don't want you all engaging in conversation around what we think will likely become a ballot measure because we don't want to be seen as influencing a ballot measure. So it became really key to have community advocates like Vanessa Bohm, Kent Wu. So I'd love to hear from you all from community. What inspired you all to get involved early? Because we did hear from some community folks, we're dealing with affordability crisis, violence, homelessness. We don't have time or energy to spend on sugary drinks in this moment, but you all were some of the early leaders that stepped up. And so please Kent share, and then I'd love to hear from Vanessa after. Why did you all step up early, and what enabled you all to engage in that way as advocates?
I think for Nikos, it was already aligned with work that we were doing. So prior to the advocacy around the soda tax, we had been doing work around healthy eating and being active, which was a very big movement at that time. So it's just very much in line with what we were doing, what we were seeing around the community, and around the partnerships that we were building with UCSF, with Cabrera, and with other organizations that had these concerns. So it also built upon other partnerships that we had, including with Supervisors Marr and Supervisor Wiener at that time. There was a study that came out, I think maybe about a year before soda tax came out, or the movement around soda tax came out, around children's oral health. So the Health Commission had come to our community and said, these are all the neighborhoods that have been affected by oral health issues. And it turned out that Chinatown had the worst of all. So there was a red spot on the map. And that was something that we knew we needed to address, and had started to link with Supervisor Wiener at that time to champion getting funding around addressing these issues. So again, it was just the stars were aligned, things were coming together, and it just all happened for us in that way.
Thank you, Kent. And Kent is the executive director at Nico's Chinese Health Coalition. And when I met Kent, he had already had partnerships with UCSF by way of Dr. Tung Nguyen, lay promotora, lay health worker education and community, I believe, around colon cancer, if I remember correctly. Thank you. And Vanessa from Central American Resource Center, why did you all engage early?
Thank you, Roberto. It's a pleasure to be with you all today. Very similar to Nikos, I think Parecen has a long history of working with the Latino immigrant community, and we've been doing health promotion and work since the founding in 1986. We essentially train community health workers to provide health education to our community members, particularly around chronic disease, diabetes prevention at the time, children's oral health. And through this work, we were already partnering with UCSF. Parecen's part of the Chicano Latino Indígena Health Equity Coalition. That coalition had a seat at within the SF-HIP work that was taking place. UCSF also had on its staff folks who had deep connections with community and who were helping to lead that soda tax effort, including yourself but other staff members as well. So we already had relationships. And so when we were part of these meetings and discussions, it felt like we already had built trust and a relationship with institutional partners, which is very key to joining any effort. I think the other thing is that Parecen at that time, again, was already doing health education work in our community around chronic disease. We had a curriculum, but through this effort, new curriculum was being created, the Open Truth curriculum, other sugar science curriculum that our promotoras were trained in. So that really added value, gave us more tools for us to share with community members. because we took that curriculum, but our promotoras adapted it to be culturally relevant, sensitive to the communities that that they serve. So that was this great added value to the work that we were doing, and it made sense to partner around that. I think the other piece that was important in the work that we do, we know that our community members know deeply well what are the challenges to their health. Folks know why it's hard to be healthy. And they have ideas on what will improve their health, except they're not necessarily, they're not so easily connected to policy. So folks have amazing ideas, communities know what it will take to move the dial, the needle on their health. But institutions like UCSF, academic institutions, the Department of Public Health, you all have the expertise, the policy expertise to help us translate community solutions into policies. So for example, our community members have told us time and time and time again, they need more information. They have challenges and there's barriers to accessing health information. But we only have so much funding to do this work. And Nico's, Gares, and Rafiki Coalition, so many other nonprofit, community-based organizations, faith-based organizations have been doing this work, but there hadn't been a source of sustainable funding to really tap into to expand this work or just create new opportunities to do health education. And so partnering around the soda tax was a way to work with experts who could find some kind of policy that could lead to more sustainable resources for this work, which in essence was the soda tax. The soda tax, part of that funding really is meant to support health equity work in those populations most vulnerable to chronic disease, essentially communities of color in San Francisco, et cetera. So those were all super important to helping us get involved in this effort.
Thank you, Vanessa. And the management of that resource is really led by San Francisco Department of Public Health. We'll get to hear about that more in part 2, but love to hear from you, Christina. How did involvement on behalf of UCSF, either by the scientists, the residents, the med students, the staff, in what ways did that help support the work of the Department of Public Health, perhaps in the implementation of the HEAL Zone that was funded by Kaiser or in other ways?
Great question. I think that partnering with UCSF was beneficial on so many levels. I think the connections that UCSF brought to the table, whether it's in the community, whether it's into the research community, residents, all of that together allowed us to broaden our reach. So, for example, when we started with the HEAL Zone, and we partnered with UCSF, which was the early days of SFHead, right? And together we formulated a place-based initiative that was focused on centering the community and looking at what kind of long-term sustainable changes can we make that resonate with the community, and resonate with science also. And we were able to do that. So with, Roberto, you mentioned the Healthy Retail initiative, which is also an Eric Morris sponsored piece of legislation. Ultimately, we were able to pilot that, which essentially is supporting small corner stores to bring in produce. Selling produce is a lot of work. And so we were able to do that. And, the food guardians were trained to do that. They were then working with the merchants, and the UCSF was involved in using those retail stores as a point of education for the residents, right? That beautiful picture that you showed. And, DPH has been doing these tours in different neighborhoods so that residents can really understand the circumstances that impact people's choices, right? You can't really make healthy choices if you don't have healthy options. If your neighborhood doesn't feel safe enough to be out there being physically active. So that's one way. I think when we started working on, we're really looking at a tax as a viable option. Having the deep science that Dr. Schmidt, you brought to the table and your deep experience with the alcohol work was absolutely vital for me. We had some of the data on health outcomes, health disparities, on sugary drink consumption, but partnering that with what was in the literature, what was happening in the alcohol world. Together, that made for a really strong case to our supervisors. And with the health department, I'm a civil servant. I am not allowed to be involved in any kind of a ballot measure, but we are allowed to work on policy development. And so our data that we had within the department, the science that UCSF brought, and the incredible advocates, speaking specifically about the UCSF partnership, because without our community partners, it would have gone absolutely nowhere. Those are the ways that it was just so energizing to do this work. I mean, and you talked about the awareness campaigns. I could go on for hours, but I think I'm going to stop myself.
Thank you, Christina. And another way we were able to align efforts was with EAT-SF, so Center for Vulnerable Populations, Dr. Hilary Seligman and her collaborators there were piloting a supplement where coupons were provided for low-income residents to purchase fresh produce at corner stores. We aligned that with the healthy retail work for small corner stores in the Bayview, where the healthy retail transformation had happened. And that program got expanded, later funded by the soda tax. And so shout out to that crew for that excellent work. And Dr. Seligman and Dr. Schmidt also, by way of the impact program, provide advising consultation to scientists interested in translating their evidence into policy. So I'd love to transition into this conversation now of what folks are working on currently that's exciting and that may offer opportunity to the family medicine community, beginning with you, Dr. Schmidt, perhaps around work with impact or elsewhere that you'd like to describe.
Yeah, the impact program for folks at UCSF and also in our affiliates and partners in the community is a resource for anyone who wants support and help in taking information from science and translating it for policymakers and figuring out who to talk to and how to move the dial on health by getting our research out of the ivory tower and into the community so it can do great stuff like soda taxes. In terms of what I'm working on now, my heart lies in developing and testing and launching new innovations to address cardiometabolic disease risk through regulatory and environmental changes. And so since the soda tax, and now there's, as I mentioned, a whole worldwide community and many, many experts available to work on that and study the impacts and make it all work. My lab has been focusing on two different novel strategies. One involves workplace interventions. We have a 16 site cluster randomized trial in collaboration with Jamie Schmidt and colleagues at Sutter Health, where we're randomized hospital units or campuses to remove sugar sweetened beverages and do very light touch, brief intervention type strategies, very similar to tobacco and alcohol free workplaces, and trying to leverage some of those strategies and study their impacts on cardiometabolic disease risk through blood sampling, which is why we like to work with health systems, because employees can get their blood test before they go to work. And that's a very exciting new way to think about environmental strategies to impact food. The other one is a project called Nourish, where it's an NSF and USDA funded project, very closely aligned with healthy retail. And my exposure to San Francisco's efforts in that area was part of what drove this innovation. But we're building an AI-enabled platform that will work with small business owners and entrepreneurs in food deserts to give them everything they need in order to build viable, effective, long-lasting small businesses that sell fresh food. Things like helping them navigate all the regulatory hurdles in starting a business and dealing with how do I access affordable produce for my restaurant and so forth. So we think that these sort of bottom-up community-based strategies are really where we can make an impact on cardiometabolic disease risk. And by targeting the people in the communities that are affected by these environmental problems, supply chains in fresh food being disrupted by McDonald's and big corporations that franchise in these communities, and bolstering the ability of the community members to solve these problems from the ground up. These are strategies that we're developing and testing, and hopefully when they work, we will be bringing them very close at home to our communities in San Francisco.
Thank you, Laura. And love to hear from our community partners, beginning with Vanessa, then Kent and Christina. Just what are you excited about currently? And are there opportunities potentially for faculty, staff, learners at UCSF to engage with that work now or in the future?
Yes, so Carecen, continuing to be focused on chronic disease, one of the things that was mentioned in the presentation is community members in the Latinx community are interested in access to water. There's a high distrust of drinking tap water in San Francisco for many different reasons. And so we are working with SFPUC, the San Francisco Public Utilities Commission, to do a pilot program that waives the current $25 per tap fee to testing tap water in San Francisco. And we want to see what are attitudes before and the number of glasses during the community drinks per week before getting this testing, and after, to see if policies like removing or reducing the costs around water testing will help improve consumption of water within our community as an alternative to the consumption of sugary drinks, and as a result, hopefully addressing chronic disease. We're really excited about the project. We've been working on it for a couple of years. We're right at the pilot phase. I think there's a lot of opportunities for to work with UCSF and other stakeholders. At the risk of sounding or using a silly analogy, I think of collective impact projects kind of like baking. I know some of you have tried baking. You have a recipe in front of you and it could just not turn out edible or yummy. I see the science, because baking is a science, the institutional knowledge as the recipe. But it's the abuelita who knows how to mix the eggs, her love, her care, but her expertise in baking that recipe that really turns out amazing. And the abuelita in this case is community. And when community is involved with researching institutions, the Department of Public Health, we can really create some amazing recipes, in this case, policies to really improve health. So we would love to work with partners. I think, there's I think you were going to share maybe some ways to get connected through CTSI, et cetera.
Thank you. So while we hear from Ken, I will be sharing visuals for folks interested in connecting with CTSI to get consultation from Impact about translating evidence to policy, to get consultation or support from us about connecting with community. I'll do that. And if you all want to share Q&A, we'll get to it if we can. Please do share questions if you have them. And if we can't get to it before time's up, I'll follow up with y'all later. And I do want to save at least a minute at the end. We have an action alert that you need to hear before part 2 in January. So please, Kent.
Yeah, so we're excited about all the work that we're already doing together, and also one brand new one. So some of the work that we're doing together already is involving UCSF students with the planning of our annual Chinatown Community Health Fair, and then also having them get involved on the day of. We're also excited about the trainings that we've been doing with UCSF. So for instance, we've been doing tours with the National Clinician Scholarship Program Fellows, giving them a sense of what the community is like here in Chinatown, what some of the social and health issues are for them, so that they have that when they become practicing professionals. We're also working with the Department of Psychiatry right now with their students on how to work with interpreters in mental health settings. And that's been really exciting also. This is the second year that we're doing that. One big thing that we're embarking on right now is I've just agreed to be a part of the community advisory board for an Aspire project, which is a research study on cancer. It's going to be the biggest one ever on Asian Americans nationwide. So we've yet to meet, but looking forward to seeing what we can do about that. Asian Americans are the only group for whom cancer is a leading cause of death. So it took many years to get here, but so glad that Dr. Scarlett Gomez has gotten funding for it, and looking forward to seeing how we can help that out.
Wonderful. Thank you, Ken. Christina.
I'm going to be really brief. I am so excited to see what the soda tax funded organizations have been able to do, including Caras and what Vanessa, you were talking about, what the oral health task forces have been doing. And that is probably really best to segue for Abby.
Thank you, Christina. Abby, please share an action alert for us. What do folks need to know around what's the latest with the soda tax?
Thank you all. Good afternoon. I'm Abby Cabrera, the Associate Director of Research and Community Engagement within the Center for Excellence of Primary Care in our Department of Family and Community Medicine. I also serve as the co-chair of our Sugary Drinks Distributor Tax Advisory Committee. And I want to share a brief but very important message and call to action regarding the threats to the soda tax and how it directly impacts our communities that are also impacted by the chronic disease. So as you have heard through the presentations today, the tax was enacted to address the disparate effects of chronic diseases caused by sugary beverages on our communities, especially communities of color. And as you've heard from Kent and Vanessa, there is no one more suited to address this disparity than by the community itself. As a brief reminder, the tax is not a sales tax. The distributors are the ones responsible for paying the tax. However, merchants may choose to pass the cost of the tax to consumers. And in our committee, we are a 16-seat advisory committee. We evaluate the impact of the soda tax, and we make recommendations to the mayor and board of supervisors regarding the potential establishment and or funding of programs to reduce consumption of sugary drinks in San Francisco. So we do not have the final say in the way the money is allocated. However, in the last 6 years of the committee's recommendations, we have consistently recommended prioritizing the most dollars to be allocated to support community-based organizations within the Healthy Community Supports Grants, policy systems, and environmental grants, as well as community oral health task forces. So that has afforded close to 40 community-based organizations the ability to provide direct services to communities most impacted by chronic disease. So as you might know, there have been severe recent budget cuts. And so we saw major cuts to programs and services that affect our communities in need, And unfortunately, severe cuts were also made to the soda tax, its funded programs. So the mayor's allocation was not aligned with the Sugary Drinks Distributor Tax Advisory Committee recommendations. And after a month of intense advocacy for add-backs to support CBOs and oral health task forces that work directly with community members, much of the burden was placed on community members to do this advocacy. And it is our community members, as we hear, that do the work and know the work of what will support, but we cannot continue to place that burden on our community members to advocate. Fortunately, the Board of Supervisors added back some of the cuts. However, we continue to face more cuts and threats to the direct services that community-based organizations serve in our community. So we cannot wait until the beginning of each budget season to share the impact of the soda tax. And I want to clarify that there is a misperception that the sugary drinks distributor tax funded work does not provide direct services or food distribution, when in fact, many funded CBOs and task forces do provide direct services and or food distribution. So remember that this is only the beginning. Our city is still recovering from COVID and budget season is all year long. So the way that folks turned out in support of the community-based grants was eye-opening for policymakers, but we need to make sure that after this election, all of them are aware of the amazing work that all of our community-based organizations and task forces do. So we ask that you support the Sugary Drinks Distributor Tax Advisory Committee. There are so many ways you can do that, because in turn, the soda tax supports your patients and the diverse communities that make up San Francisco. I want to reiterate again that the burden of advocating to support community should not be placed solely on the community. It's our responsibility to maintain our trust with our partners in community-based organizations and responsibly engage in partnerships, in true community engagement, and in turn, policy and sustainability. You can also advocate on behalf of the committee, requesting the mayor and the Board of Supervisors follow the recommendations of our Sugary Drinks Distributor Tax Advisory Committee, and encourage you to share your thoughts with myself or our committee. You can attend our subcommittee meetings. We have monthly committee meetings every third Wednesday at 5 p.m. It's online via Zoom. You can hear some of the great work that's being supported by the soda tax. You can share your public comment. I have shared details of the meetings in the chat, and also please take a look at our soda tax website. You can look at data dashboards. We have interactive maps, so you can see by district. So maybe the patients that you serve, where there are water stations, where there are soda tax funded entities in your district. So this is only the beginning. Like I mentioned, we're keeping an eye on the election, but also want to encourage you to join on January 10th so you can hear how the soda tax is being implemented and ways that you can support the soda tax moving forward.
Thank you so much, Abby. And thanks to all our panelists for joining us today. Thanks to Dr. Venner and Roy Johnston for hosting us, and to all the folks providing tech behind the scenes to make this happen. Thank you, family, community medicine community. Look forward to seeing you all January 10th at noon for part 2 of this story.
Thank you to everyone. Have a wonderful afternoon. Appreciate your joining us and appreciate our team for a wonderful presentation today.
Thank you.